ribs are sharp. Let me see if I can break them a little closer. Sorry. There, that's better. There. And they won't be so dangerous stabbing up at the hands. Okay. Now, sorry. Got distracted. Alright, so the first thing coming up off the heart is, there's some blood, the aorta. It goes aorta, aortic arch, and it's going to go on down to the thoracic aorta. The first branch off of that is the brachiocephalic. So the brachiocephalic artery, it's going to branch into the right subclavian, right common carotid, left common carotid. On this side is the left subclavian. So there's some nerves in the way. But there's that left subclavian going off to the left arm. Alright, so subclavian's on the outside, carotid's on the inside. Alright, so I'm going to track some of the smaller things that are going off of that subclavian. And then we'll track the whole length of the subclavian. So, first things first is this little tiny artery called the internal mammary artery.
Here's what I found on the web for there's that left carotid on the inside. Track some of the smaller things.
Wow, okay. Alright, so that is the internal mammary artery, and it's going to come up and it's traveling along the sternum. So you can see little bits of that internal mammary up here too. The next one is this guy, the vertebral. So together they make the IV, internal mammary and vertebral. So I'd poke at this one a little more and see if you can get it to stand out a little bit better, but hey, there we go. There's that vertebral. Alright, cross the chest wall, go in here a little bit more, and this guy that stands up a little bit, it had two, one going this way and one going this way. You can still see a little bit of this one left. This is the costocervical headed this way, thyrocervical headed that way. So costo and thyro. Now, last little muscle coming down this way is the subscapular artery. So that's the subscapular artery. And then now let's name this entire long, big main road. So that's the subclavian. Subclavian turns into the axillary in the armpit. As soon as you cross that subscapular, it turns into the brachial artery. And the brachial artery will go off and split, I can see a little bit of the split here, into the radial towards the radius and the ulna towards the ulnar. So radial, ulnar. We usually pin those where it's pretty clear. You can see that there's two of them there. So radial, ulnar. Alright, back to the carotid. So we have the left common carotid coming up, and it follows all the way to here. And deep inside here is the internal and external carotid arteries. It looks opposite of what you would expect. So that one's the internal, and this is the external. Internal, external. Okay, so that's it for the arteries in the chest. Yeah, let's head to the veins. Alright, your veins, I'm not gonna lie, are kind of destroyed. But I will draw imaginary lines. So, you ready?
Yes.
There's two external jugular veins that come up. This is the remnants of that, right there, external jugular vein. There's one little internal mammary vein that comes up this way. In the arm, you have the axillary vein, brachial vein, radial ulnar vein. They do the exact same thing as the arteries. And underneath the lung and the heart, there's one extra vein, the azygos vein. So that's this one in the back, azygos. Yep, and that's all of the veins.
Okay.
So the veins are fairly simple compared to the arteries.